Omar. There's a bad
Yeah.
Huh?
Good morning, everyone. My name is Jared Jimenez, and the topic for our debate today is taxation on high-fat processed foods to help prevent obesity by lowering obesity-related illnesses and medical costs. Isn't it funny that today we live in a world where Twinkies are cheaper than carrots and Coca-Cola competitive with water, where the two-thirds of our population is obese? It is sad to stroll down the street and see stores and restaurants that provide processed foods. Today, I am going to discuss the following points regarding the tax on high-fat processed foods. And one, it will help prevent obesity by lowering obesity-related illnesses like diabetes or heart diseases and reduce medical costs. Two, it makes healthy foods more attractive to the public. And three, it has been proven in the past that similar same taxes deter unhealthy behaviors. Taxing high-fat foods will help lower obesity rates and reduce medical costs related to obesity-related illnesses. According to the American Medical Association, the United States is the second most obese industrialized country in the world. 2013 report stated that 31.8% of Americans were obese compared to 14% in the mid-1970s. And obesity and obesity-related health conditions cost an estimated 10% of annual medical spending in the United States, totaling $147 billion in 2008. Also, obese people spend 42% more on healthcare costs than healthy weight people. So it is important to introduce a tax on high-fat foods, but our efforts are not enough. According to Delos M. Cosgrove, the heart surgeon who is the clinic's chief executive, our national weight problem brings huge costs, both medical and economic. Yet, our anti-obesity efforts have none of the urgency of our anti-smoking effects. We should declare obesity a disease and say we are going to help get you covered, Cosgrove said. And taxation needs to be at least 20% to have a significant effect on obesity and cardiovascular diseases. Like I said before, we live in a world where Twinkies are cheaper and Coca-Cola competitive with water. Since the majority of the products are processed, we can all say that they have high content of sugars, fats, and whatnot. So by taxing high-fat products, we will reduce the purchase of these unhealthy products by making healthy foods more desirable to the public. People need an incentive to eat more healthy food and avoid unhealthy fats. This will improve people's health. In a paper published last year in the British Medical Journal, Tom Marshall, a professor at the University of Birmingham, said that taxing fatty foods will prevent hundreds of premature deaths each year and cut the incidence of heart disease by about 10%. According to an article from the Washington Post, New York's trans fat, which was implemented in 2006, did reduce trans fat consumption significantly. According to a 2009 study that found that the percent of the restaurants used trans fat increased from 50% to less than 2%. We can all say that by introducing a tax on these processed foods, people will be bound to consume these products way less. For consumers to transition from in the New York trans fat was seamless. Most New Yorkers didn't even notice it. According to Christy Curtis, a co-author of the study and director of the city's nutrition strategy program. It's not a matter of price, it's a matter of taste. People will be bound to purchase products that taste good for them. So, by allowing people to have a choice in what they eat, people will be bound to purchase products that will be helpful for them. I believe the biggest problem that we have is that we haven't implemented a tax on high-fat products yet. We have seen in the past with cigarette tax and studies done on the taxation of harmful products the dramatic decrease of their use. The cigarette tax could serve as a model for a tax on obesity-causing foods. Following the implementation of a steep cigarette tax in the late 1990s, effectively raising the cost of cigarettes by 50%, smoking rates plummeted sharply. Today, less than 20% of Americans are smokers. A started departure from smoking peak in 1960s, when 42% of Americans smoked regularly. In regard of obesity, what has changed is that parents are working longer, and take-home meals have become a default dinner. Gym classes have been cut. The real price of soda has fallen 33% over the last 3 decades. The real price of fruit and vegetables has risen more than 40%. How can we stop this madness if people don't make the right choices? I believe taxing high-fat products will help them significantly. We can make this happen by increasing the cost. By increasing the cost, we make it easy for people to make the more helpful choice. The tax money can be used to increase awareness about the harm of junk food and fund projects that encourage better choices. The Food and Drug Administration will be in charge to establish the guidelines for the tax on fat to work efficiently. The FDA will make sure that establishment follow the regulations by sending an inspector to make sure that everything goes as planned. And a penalty will be set for those establishments that do not comply to the new safety regulations, with an increase of 1% per year for further offenses. Together we can make this work. People will have the option to eat healthier, because the taxation will increase the price of such products that will match the products of healthier choices. I believe that we can all make a difference. Taxation of high-fat products will help reduce obesity rates and will allow our citizens to be healthier.